When I first started as a junior doctor, it was difficult because I actually found all parts of medicine really interesting. You get to see problems and get to solve them, and it was the problem-solving aspect that got me interested in surgery.
One example that comes to mind this week, I saw a patient who went from being BMI over 45 to 12 months later embarking on her training to become a personal trainer, and she's done really well.
I'm a general surgeon who's then specialised in upper gastrointestinal surgery and perform also interventional endoscopy. So within the general surgery spectrum, that includes cholecystectomies with gallbladder surgery, as well as the whole gamut of hernia surgery and other emergency surgery and trauma that entails.
I've been in general practice for 20 years, and one of the things I've loved about being a physician and having that role is the fact that you follow people over time, and so that really suits the fact that I love relationships and I like helping people.
What interested me in upper gastrointestinal surgery and bariatric surgery was the complexity and the fact that it was a reasonably new field and things were changing a lot. So a lot of the procedures that we do now weren't taught when I was doing my training. So being on that journey of discovery and learning new things that I can then use to help patients has been fascinating and enjoyable.
Specialist training in general surgery in Melbourne. I embarked on subspecialty training in upper GI and subsequently bariatric surgery.
Through language speaking at home and then further studies, I speak both Cantonese and Mandarin. So I'm able to provide consultations in English as well as in those languages.
I've learned a lot about what works and what doesn't. Also, we've got a real feel for how the different procedures work over time, and if a problem occurs, we're very experienced at how to fix that problem up.
The thing I really love about it is we've got lots of different health professionals working together. So we've got the surgeons and the physician, of which I'm one of those physicians, and then we've got a dietitian, some nurses and a psychologist and other office staff, and we actually work really well together as a team, and I think the patients really benefit from having that team approach.